Hello, everyone. And today I would like to talk about benefit of lifestyle changes, and I'll talk about high blood pressure and diabetics. A lot of times, as I work in the hospital, you see patients coming in with these issues, high blood pressure or diabetic. Either it's diabetic foot injury, is that the blood sugar is too high, DKA, or it's too low, hypoglycemia, or either it's diabetic neuropathy, diabetic that is affecting their renal, diabetic this, diabetic that. So many different issues that they come in with that is related to diabetics or high blood pressure. And one of the things you want to find out, you tend to find out is it they don't know a lot of the information that they can do themselves to change the lifestyle, or they just stubborn of whatever the case may be. So I'm just going to address both issues, both diabetic and high blood pressure right now, and I hope it benefits someone out there. So before I continue to go on, we're going to listen to this video. It's for 15 seconds, and I'm gonna expand on it.
If you got a high pulse, you're not moving your body enough. If you have a high systolic pressure, that means your arteries are stiff. If you have a high diastolic level, that means your sodium is too high. All of these things can be fixed by simply changing the way that you live.
So one of the things that a lot of people don't understand or put in charge of the way they live their life is sodium is a water soluble. That means you're peeing it out. So for you to have a high sodium in your body, you are eating excessive it, like so much. And the one problem that we have is you may be eating a lot of sodium, either from diet, from food, or from fried chicken and whatever you eat, but you're not adding enough potassium to off scale it so that you can pee it out, or else it's going to stay in your system because you may not be peeing a lot and all that stuff, and you're going to have so many different complications from that. Now, the problem I'm having is, see how you listed first, you're not moving enough, you have IPOS. That's because most of our lifestyle circle around sitting down, and most people are not encouraged to exercise or to move all around, and our weight doesn't even help it as well. That also, if you have a steep artery, which is going to increase your diastolic or systolic blood pressure, that's because you eat so much processed diet and also high food with greasy. So that will create so many like plaques in the artery that will create like high systolic. The same for diastolic as well, which is you're not moving, you're not doing so much exercise and all that stuff. Now, what is the benefit of lifestyle changes? Lifestyle changes, so many different things. Here is from Mayo Clinic. There's a 10 way to reduce and control your blood pressure without medication. When you lose excess weight, especially your waistline and all that stuff. A lot of people doesn't even know what their height to weight is like it's supposed to be, or some people doesn't even know what the normal blood pressure is, talk less of what their baseline blood pressure is. If you don't know what your baseline is supposed to be, how are you going to know when you have high blood pressure? Because one in three adults in America have high blood pressure. The same for diabetic as well. So you say here, exercise regularly. Enough exercise, at least 30 minutes of moderate exercise activities like you're walking, you're running the treadmill, enough alone is enough to get because your heart is also a muscle as well. Having it pumping as well will really benefit and goes a long way. Healthy diet. I can't tell you enough how much healthy diet benefits you, because right here you say if you eat vegetables and food that is rich in potassium, it will help lower your blood pressure a little bit. This study is made from is supported by British Health Foundation, Harvard University, that they already do extensive research on this. Also, hibiscus tea. Hibiscus tea has been researched on multiple times to, like, when you drink it, it helps reduce your systolic blood pressure. It helps in multiple ways. This is all lifestyle changes. I don't know anyone that hates tea, but I don't know. Also, beetroot. Beetroot is a fruit. and it's also you can get it in powder. This is from American Heart Association. This will help you regulate your blood pressure because it's loaded in nitrates. Nitrate will help dilate a little bit of your blood vessels so that it can increase the blood flow. It lengthens the time and all that stuff. It also remove all the fatigue and all that stuff. The same goes for pomegranate juice, something that you can buy from the store. Drinking pomegranate juice, just make sure you buy 100% juice, not the one with artificial sugar and all that stuff. These are the ways that can help you reduce your blood pressure. And those are the things that you can do at home. And now to the issue of diabetic. Diabetic is something that a lot of us think is high sugar and all that stuff. But one of the things that you forget is if your pancreas is working functioning, if it's working properly, you won't have diabetic, type 1 or type 2. Now, there is a documentary that was done, Simply Raw, Reversing Diabetic in 30 Days. I encourage everyone to go watch that documentary. It was already made out there. That is type 2 diabetic, reversing it. It helps. The information you have will really goes a long way. Now, if you go to how to manage your diabetic, type 2 diabetic especially, uh, Healthline, written by physicians, they put in like cinnamons. All this discuss with your doctor. I'm not prescribing anything. I'm only encouraging you to do enough research and discuss it with your primary physician so that you can work together to remove all this medication from you. Even metformin that we're talking about that they give the people to glynoperate, all that stuff, they only work like 45% at most. So just making sure you are aware. Cinnamon is very clinical research that shows turmeric and rosemary, they help with reducing inflammations as well because this issue is of eye. Diabetic is an inflammation of the pancreas. So if they reduce that, it will really help you benefit greatly. Vitamin B, so many different, like reducing stress as well. Your stress level will affect everything in your body. Either it's your blood pressure, either it's your diabetic, whatever the case may be. If you reduce your stress level, you're able to sleep well, you regulate yourself much better. Yeah, everything will naturally take its natural course. Your body will repair itself. So I'm asking you and I'm imploring you to do more research and change your lifestyle. Reduce the amount of stress in your life and try as much as possible to regulate so many different things. So on the issue of the cinnamons, even Hopkins, they already do research on it about spices that benefit that regulate blood sugar. Right here, cinnamons regulate blood sugar. They have the article on that. They have turmeric reduce inflammation. As I said, diabetic is an inflammation of the pancreas, and pancreas not producing enough insulin. That's what they will call it. But whichever one you want to look at it, if that reduce, it will really help. Apple cider vinegar also benefits and all that stuff. Like ginger for nausea. So there's so many information out there. It's up to you to know what you want for your life. It's up to you. If you don't mind taking the real insulin, pricking your fingers, attaching stuff in your hand, all that stuff, you are in control of your life. But just make sure, remember that everything have a benefit for some people. If you're on medication keep going up these days. Some insulin can cost up to $1,000. I don't know how people who have the money to be giving out for fun. But this is just the information for you to benefit your life. I hope you find time to take good care of yourself. Again, I'll quick recap for diabetic. Cinnamons helps. Discuss with your doctor. Cinnamons, turmeric help to reduce inflammation in the body. Ginger, also many different stuff, and also magnesium, food rich in magnesium. All these are foods that like fish, all that stuff. Another thing is for blood pressure, exercise. If you have high blood pressure or high pulse rate, you're not living an active lifestyle enough. Take 30 minutes a day is good for you. It's recommended. If your systolic is high, you're having stiff muscle and all that stuff, that's because you're eating so much greasy food. Reduce the amount of greasy food you're eating. So I will encourage you to eat food rich in potassium, which is vegetables and fruit that will help lower your blood pressure, gets under control. Hibiscus tea, it helps. There is research done on that as well. There's research done on high potassium rich food as well. Beetroot is rich in nitrates that help all these lower blood pressure as well. All this discuss with your doctor, not prescribing anything. Pomegranate juice, 100% juice. Work both on short time and long time. Try and much as possible to regulate your lifestyle. I have a patient of 35 that are having high blood pressure crisis and all that stuff. While I have some patient of 90, 85, they're not even on blood pressure medicine. So I hope you take good this information to benefit your lifestyle, and I wish you all the best. Thank you.